Okay, so for the next aspect, we are trying to look at the symphysio-fundal height. Some people call it the symphysial-fundal height. So it's basically a measurement that healthcare providers do. This mostly when the pregnancy has gone past week 20 to week 24. So measuring from the pubic symphysis right to the xiphisternum will give you a rough estimate of the gestational age of the pregnancy. Do you understand? So when you measure it, you add plus 2 weeks. Anything you get in centimeters is in weeks. Okay, so you add plus 2 weeks or minus 2 weeks. Okay, and this should give you, okay, within range of what ultrasound scan is telling. Okay, so there are things that could actually make the symphysial-fundal height to be so large. Okay, there are things that could make the symphysial-fundal height to be so small. So this will tell you that it's too larger than the expected gestational age, or is smaller than the expected. Do you understand? It's not within range again. So it's actually a clinical measurement. It's used to assess fetal growth, uterine size during pregnancy. So it's the distance from the pubic symphysis to the top of the uterine fundus. Okay, sorry, I didn't say, I actually said xiphisternum, right? Sorry, is from the pubic symphysis here to where the fundal height is. Okay, the xiphisternum measurement is the linea nigra. Okay, sorry, I mistook it. Sorry. Okay, so we said that is the distance from the pubic symphysis to the top of the uterine fundus. So usually measured from week 24 onwards. Some people say week 20 onwards. Okay, so when anything you get in centimeters, add 2 centimeters. That's anything in centimeters is weak, right? So if I get 30, I'll now say, if I get 28, I'll now say 28 minus 2, or 28 minus what, or 28 plus 2. So anything I get, that's basically it. Okay, so if the symphysial-fundal height is larger than what is expected, it could be that the baby had Macrosomia. I mean, all those complications of diabetes mellitus. It could be that the amniotic fluid is too much. Do you understand? It could be that the pregnancy, there is not one pregnancy. Okay, it's multiple pregnancies. Then it could be incorrect dating. So it could be that the estimated gestational age that maybe you guys calculated from last menstrual period that the mother told you was not correct. Okay, it could be that the mother is big or the mother has fibroids. Okay, so what to do? Confirm the gestational age using ultrasound. That's the golden standard. Although students and healthcare practitioners should know this traditional standard. Okay, because this is what builds your skills in gynecology. You can also perform growth scan and access amniotic fluid index. You can now screen the mother to see if she has any gestational diabetes complications. So a small fundal height, it could be that the baby is experiencing intrauterine growth restriction. It could be that the amniotic fluid is small. Okay, it could be incorrect dating too. Okay, it could be that the mother is smoking, the mother is not eating well, the mother has chronic diseases. So this one, what to do? You order for a growth ultrasound and Doppler studies. Keep monitoring how the baby is moving and the well-being of the baby. Then you can consider to refer the mother to a place that she can receive better care, or if you can handle it, then you start exploring your options.